Good morning. I want to thank Cook County Chief Medical Examiner Dr. Toni for her work here at the Medical Examiner's Office and for hosting us this morning. Thank you to Cook County Health Chief Executive Officer Israel Rocha and System Director of Infection Control and Hospital Epidemiology Dr. Sharon Welbel, and Cook County Department of Public Health Senior Medical Officer and co-lead Dr. Kiran Joshi for joining me to mark another somber milestone of this pandemic. Last night, the Medical Examiner's Office confirmed the county's 11,000 deaths since the pandemic began last year. That's 11,000 of our neighbors, our friends, our family members. And that's hundreds of thousands of grieving loved ones left to pick up the pieces. Let me talk about the last two deaths. A 31-year-old African American from Chicago's Austin neighborhood and a 28-year-old Latino man who resided in Little Village. To everyone watching today, I implore you to get vaccinated. No matter your age, no matter how healthy you are, you're susceptible to the virus. It can kill you. And it would most certainly leave devastated family and friends behind. If you are a person of color, our black and brown communities, you are disproportionately impacted. In the last month, more than 46%, almost half of our COVID deaths are in the African American community, and more than a quarter are in the Latinx community. While Dr. Runkumar will talk about these cases the office is seeing, our colleagues at Cook County Health and the Department of Public Health will give you the latest information about the Delta variant, how this surge is impacting the county, our latest masking guidelines, as well as how you can get the vaccine. So the pandemic is not over. I know we're all suffering from plague fatigue, but the pandemic is not over. In fact, the case counts are up by more than 130% in Illinois in the past 2 weeks, and deaths are starting to creep up as well. If we all do our part, however, we can mitigate the effects. I'm very grateful to our team here at the Medical Examiner's Office, to our colleagues at Cook County Health and the Cook County Department of Public Health for their tireless efforts over the course of this pandemic under extraordinary circumstances. Thank you again for your dedication and commitment to our residents during this challenging time. Dr. Runkumar?
Good morning.
Good morning.
Thank you, President Preckwinkle, for continuing to highlight the threat COVID-19 still poses to our community. I'm grateful to our colleagues from Cook County Health and Cook County Public Health for their efforts to save lives throughout this pandemic. I know their work, both treating COVID patients and ensuring as many residents as possible are vaccinated, has undoubtedly saved many lives. While our death rate remains relatively low compared to the numbers we saw earlier in the pandemic, I remain extremely concerned, and here are the trends we are seeing. Overall, just under 7% of all the county's 11,000 COVID-19 deaths were in people under the age of 50. Last month, that age group made up 18% of Cook County's COVID deaths. Our Black community made up approximately 29% of overall COVID deaths, but in July, African Americans accounted for 46% of those deaths. Under 22% of COVID deaths during the course of the pandemic were in the county's Latino population. In July, Latinos made up more than 25% of COVID deaths. COVID cases are beginning to rise in our morgue once again. This is something most of us do not want to see. 11,000 COVID deaths is 11,000 too many. My team and I have spent countless hours confirming COVID-19 infection deaths in people who did not think it would happen to them. To our residents, I have this message. Please get vaccinated. You could be saving your life. You could be saving the lives of your loved ones. You will make a difference. Thank you. Israel Rocha, the CEO from Cook County Health, will give his remarks next.
Good morning, everyone, and thank you so much for joining us today. I want to start by having a special thank you to President Preckwinkle and our commissioners and all of our health officials for their tremendous efforts in the response to COVID-19. Their leadership has been essential in helping to help our community be able to confront and to survive our COVID-19. I'm Israel Rocha, the CEO of Cook County Health. Since December, we have been working around the clock to vaccinate our patients, our staff, our residents, all across Cook County. In all, Cook County has provided nearly 875,000 doses of COVID-19 vaccine to through our mass vaccination sites, but that is not enough. We still have more work to do. I do want to say that while we have pivoted from a mass vaccine center to a local approach, we want to make sure that everyone can get their COVID-19 vaccine. This is a time to make your plans. Whoever's listening, today is a somber occasion. We celebrate over 11,000 loved ones. Those are 11,000 families in Cook County who are without a member of their family because they have had to confront the challenges of COVID-19. To honor those men and women, those individuals who have lost families, those families who are now without loved ones, please make plans for you and your family to get vaccinated if you have not. If you are over the age of 12, now is your chance to make that plan. Visit myshotcookcounty.com to get all the locations and sites that you need to. I will say that again. myshotcookcounty.com has all the locations and places where you can get vaccinated. While we are here today marking this somber milestone, the tragic loss of life due to this global pandemic, I want to recognize the amazing achievements of our medical community and the amazing achievements of everyone throughout the entire county for making plans, for taking time to get vaccinated. The most heroic thing that you can do in this pandemic is to get vaccinated to help protect you and your family. All can be heroes because every time you help to mitigate this pandemic, every time that you help to mitigate the ability of this pandemic to continue, you are helping to save lives. Every Cook County resident can be a hero by getting vaccinated. Today, we ask you if you're taking the wait-and-see approach, please consider changing your plans. Unas pocas palabras en español. Ahora estamos aquí para celebrar, no para celebrar, para reconocer un día muy serio. Hoy en este día marcamos más que 11,000 millones han perdido su vida en la lucha sobre COVID-19. En este momento y en este día marcamos un día muy serio. Reconocemos las familias, todas las personas que han perdido su vida en esta lucha sobre COVID-19. Es importante que sabemos que las comunidades de colores, las comunidades, han estado impacto más grande sobre esta lucha sobre COVID-19. Pedimos con todos nuestros corazones y con todo lo que podemos que si no han sido vacunados, que por favor vengan a myshotcookcounty.com para poder agarrar sus planes, para saber dónde poder agarrar su vaccinación para usted y para su familia. Es muy importante en este día que conocemos que más que 11,000 han perdido nuestra vida. La mayoría de esas personas han sido personas de las comunidades vulnerables. Es muy importante que tenemos esa oportunidad para hacer un plan, para poder ayudar a nuestra comunidad, para salvar las vidas de nuestra familia, hacer un plan para poder ganar su vacunación. Es muy importante. Lo que han oído de los gente que ha hablado antes es que esta epidemia no está completa. Todavía en este momento estamos mirando más personas que están infectadas con esta COVID-19. Este es el momento, por favor, hagan su plan para usted y para sus familias para ser vacunado sobre COVID-19. Toda nuestra comunidad puede ayudar a salvar las vidas de todos si agarramos esta vacunación. Es muy importante en este momento que hagamos el plan, que vayamos a agarrar vacunado y que recordamos que todavía no estamos acabados. Todos están cansados de esta epidemia, pero no podemos estar tan cansados que vamos a perder las vidas de nosotros o las vidas de nuestra familia. Por favor, les pedimos con todo, hagan su plan para agarrar su vacación. Thank you.
Next, we'd like to bring to the podium Dr. Sharon Welbell, who's System Director of Infection Control and Hospital Epidemiology.
Thank you, Thank you, President Preckwinkle. I'm sad to be here today as we note this tragic milestone of lives lost. Thank you. Recognizing that vaccination could have prevented many of the deaths that we have recently seen in our community. The highly contagious Delta variant, now the predominant strain in the U.S., is spreading rapidly and possibly causing more severe illness. If we do not act urgently, we will see hospitals in Cook County overwhelmed with sick and dying patients, including children who are not yet able to get vaccinated. Vaccination is the most effective intervention we have today to save lives. People who have not been vaccinated, are immunocompromised, or are unable to be vaccinated, are of course at the highest risk of disease and may not be able to escape this highly contagious and possibly more virulent virus. Every day, hospitals across the country are admitting almost exclusively unvaccinated patients into their COVID and intensive care units. As a healthcare professional, it's devastating to witness the surge of this Delta variant across our own Cook County. We have highly effective and safe vaccines that we know prevent hospitalization and death. And although millions have already been vaccinated, it just is not enough. The vaccines will reduce your chance of being hospitalized with COVID-19 by almost 94%. And we are fortunate to live in this country where vaccine is highly accessible. Just about a month ago, by easy access to the vaccine in June, Cook County was averaging only 8 cases of COVID per 100,000 residents. And our test positivity rate was less than 1. It was 0.7. That was just about a month ago. Since then, we've seen over 130% increase in COVID cases just in the last 2 weeks, and more than 2,000 cases being diagnosed in just 1 day in Illinois. And in Cook County, we've seen more than a 30% increase in the number of cases, and our positivity rate has increased to 3.18%, and in the state, it's about 5% now, resulting in CDC's announcement that Cook County and the city of Chicago were experiencing substantial community spread of COVID-19, which we'll hear about has changed our masking practices. And while vaccine breakthrough cases, I feel, receive disproportionate attention, the vast majority of people with COVID are unvaccinated. That is a preventable disease. These people are highly unvaccinated. If vaccination rates remain inadequate, we will certainly see increasing hospitalizations and deaths as we enter the fall and winter seasons. Just consider the sheer magnitude of the number of deaths we are recognizing here today, and realize that each and every one of us has the duty and responsibility to get vaccinated and encourage others to do the same. It is every person's responsibility to do everything in their power to fight this ongoing, relentless spread of COVID, and I urge you to get vaccinated if you are able, as it is, again, the most effective means of protecting ourselves and those around you. And I just want to share a quick anecdote. Just on Monday, I spoke to somebody, lives in this neighborhood, said they don't want to get vaccinated because they're not seeing people hospitalized and not seeing people dying. I get that. You walk around Chicago, people are largely unmasked, outdoors and indoors. And frankly, by this time in this pandemic, people are largely immune to the statistics that you've been hearing today. But I can tell you with certainty that we will again experience what we experienced prior to having the luxury of being vaccinated, that we will experience what other states that are being overwhelmed with COVID are experienced with this highly, highly contagious and possibly more virulent variant. We as healthcare workers, pre-vaccination availability, saw our hospitals quickly fill up with COVID. We saw our patients and their fear and their suffering of dying. What I found almost most difficult was seeing their loneliness. They were not able to be surrounded by their loved ones. And we saw their loved ones on their telephones and tablets, and how sad it was for them to not be able to be there for their family member or their loved one who was dying in the hospital of COVID. We also saw our healthcare workers exhausted, their own fear of acquiring COVID, their fear of dwindling PPE supplies. We're so fortunate now that we don't have to experience this again. Look, we're already seeing more children and young adults hospitalized, not because of the rare immune syndrome that we had been seeing, but they are getting the COVID pneumonias just like their adult partners. We can prevent this. We all need to protect ourselves, our children, the immunocompromised, and everybody around us. Thank you.
Thank you, Dr. Welbel. Next, we'll hear from Kiran Joshi. Dr. Joshi is the co-lead of the Cook County Department of Public Health.
Thank you, Madam President. Good morning, everyone. As Dr. Welbel so poignantly made us aware, many of our indicators have been increasing over the last weeks, and this includes our case counts, test positivity, and most concerningly, rates of hospitalization. This is very much deja vu all over again. Because of these increases that we're experiencing and emerging data that even individuals who have been vaccinated can be prone to spreading COVID-19, specifically the Delta variant, we've issued guidance for schools indicating that all teachers, staff, students, and visitors should wear masks. Let me leave no room here for any lack of clarity. When I use the term should, I mean it is our strongest possible recommendation that everyone in schools remain masked. Last week, when CDC identified Cook County as a county with substantial community transmission, we also began to recommend that all people over the age of 2 years old wear masks in indoor public settings, regardless of their vaccination status. In short, masks matter. They matter, and we must continue to wear them. So, what are we doing about this as a Department of Public Health? We're continuing to focus on our hyper-local vaccination strategy to bring vaccines to where people live and where they work, with a focus on communities with the lowest vaccination rates, and of course, most vulnerable groups all over suburban Cook County. To date, we've completed 345 mobile or pop-up clinics with over 40,000 doses administered. We are going to continue to do this, and we will be relentless in doing more and more media to ensure that people have the information they need, doing more and more outreach, going door to door, holding more hyperlocal events in collaboration with community groups, with schools, with churches, and all high foot traffic spaces throughout suburban Cook County. I'd like to close out here with a call to action. We know that nationally, about half of the people who are planning to quote unquote wait and see have been vaccinated at this point. If you know someone in that group who remains unvaccinated, please, please urge them to stop waiting. The time for waiting is over. Urge them to get vaccinated. If they haven't vaccinated their teenager because they have concerns about safety, please tell them that millions have been vaccinated without incident. And if they need to find a place to get vaccinated or need help getting there, we can help. As Mr. Rocha mentioned, I encourage everyone to go to myshotcookcounty.com to learn about where, and you can go to cookcountypublichealth.org for help on how to get to those sites. At this point, nearly every death, every hospitalization that we are seeing is entirely preventable. If we work together, if we continue to mask, if we get vaccinated and encourage others to do the same, we can bring COVID to a standstill. Thank you.
Thank you, Dr. Joshi.
We have a number of media here with us today, so we'll take questions from them first.
All right, Brittany's going to identify people, and we're going to take questions. Go ahead, Brittany. I think, Dr. Joshi, do you want to come to the microphone, please?
Yeah, I can briefly comment. It's been slow but steady for some time now. We haven't seen we haven't seen a significant increase over the last few days or weeks. Thank you.
We'll take all your questions. Go ahead. You didn't tell us who you are. I'm sorry. Eric, okay. All right, go ahead, young lady. And you are? Thank you. Can you speak up? Okay. All right, all right, we'll take the people on the phone. We'll come back to the two folks who are here.
Let me turn it up here. All right, we have Craig with WBBM. Do you have any questions, Craig?
Craig, are you still with us?
Can you hear me now?
Sure enough.
Are you able to hear me?
Yes, Craig.
I keep hearing from people who say they're reading studies and other things that say masks aren't effective, and that's why they're resisting them for their children, they're resisting them in schools. What can we say about all of these conflicting studies that people are seeing on the internet, and who should they believe and how do they know who to believe?
All right. So there is a narrative on social media that masks are ineffective. Who would like to respond to that? All right, Dr. Joshi.
If I may quickly comment, it's simply not the case. Masks are effective, and they're a simple and cheap way to prevent COVID from continuing to spread. I want to again reiterate this in the strongest possible terms. Masks matter, and we should wear them.
I would just reiterate what's already been said. I would echo that. We know that pre-vaccine, we were able to safely, in some instances, go to school or go to camp as long as people were strictly adhering to masking instructions. Masks do matter and masks do work.
Kristen with WTTW, are you there?
Yes, I'm here. Thank you. I have a quick question. I was wondering if I could get some statistics on, I know there's been 11,000 deaths since the pandemic began, but what were the number of deaths since the vaccines became available and the percentage of those deaths that were among the unvaccinated?
All right, so you want to know the percentage of deaths of unvaccinated people since the vaccines became available roughly in January? Is that what you want to know?
Yes, that's correct.
All right, we'll ask Dr. Arunkumar to respond. I'm not sure we have this at our disposal. She does. She nods her head. Okay, hold on. Go ahead.
This is Dr. Arunkumar. I have data on the number of deaths since vaccines became available. So in 2021, so since January when vaccines started becoming available, we had 2,522 deaths, and before that it was around 8,000 deaths. Now, coming to the question of how many of those were not vaccinated, I'm not able to give specific numbers, but we see a number of cases while we're reviewing records that they have not been vaccinated. So for exact numbers, it would be coordinating our data with probably public health to get that exact number.
Just to zoom out for a second, let's remember that nationally, the national data that's being reported by CDC is very clear that 99% of deaths at this point are in individuals that are unvaccinated. This is powerful data that is a testament to the effectiveness of these wonderful vaccines, and part of the reason that we as public health professionals and public health physicians are out here encouraging everyone to be vaccinated. They're incredibly effective. They can prevent hospitalization and prevent death. Thank you.
Do we have anyone else on the line who would like to ask a question? Okay, hearing no one. Anyone else in person?
All right, Eric. All right, good. So I was at my favorite neighborhood restaurant the other day, Pizza Capri, and a couple of the waiters talked to me outside. They were fearful that the city would close down again, the county would close down, and I said I thought that was unlikely, but we were probably going to see mask mandates. And I asked them if they were vaccinated. They both said they were, but they had a number of friends who were not vaccinated. And I asked them to be an evangelist, that it's great that you're vaccinated. You got to talk to family and friends and neighbors and try to encourage everybody to be vaccinated. And they said they had tried, and what some of their friends told them is, that white people were telling them this and they didn't believe it. And I told them, I said, tell them that white people are lining up to get shots, and that white people have higher vaccination rates than black and brown people. So if they're worried that there's some kind of conspiracy on the part of white people to do damage to black and brown people, white people are standing in line to get their shots. And there's a lot of misinformation and sort of pernicious narratives in social media that imply, that we're putting chips in people and, just completely crazy stuff. And I would ask that people listen to the folks whose job it is to help us take care of ourselves, and that's our physicians, our public health specialists, our epidemiologists, who've made it quite clear that it's important to be vaccinated, and even if you are vaccinated, to mask up. Anything else? Yes. Yes. All right, thank you, Mark.
Can anyone talk about some of the few breakthrough cases that are coming in, the differences in the symptoms from vaccinated versus unvaccinated?
All right, my caution again is that breakthrough cases have gotten a lot of attention, and it's disproportionate to the number, in fact, of cases. But where are we? All right, Dr. Welbo.
Thank you. Great question. We are seeing less symptomatic people who are in the vaccinated persons. People will present with a runny nose, a mild sore throat. I've often heard people say, I feel like it's allergies, but I'm not sure. I want to be safe, so I don't give this to anybody, and I'm going to get tested. So we're largely seeing really mild disease. And that's fine. This is what vaccines are supposed to do. You may have mild disease, which is a nuisance, but you will not be hospitalized and you will not die. That's what's so important.